I'm Dr. Sanjay Agarwal, consulting diabetologist. I head the Department of Diabetes, Obesity and Metabolic Diseases at the Sahyadri Hospital, and I'm the Secretary General of the national body, the Research Society for Study of Diabetes in India, the RSSDI. This was conducted by Dr. V. Mohan from Chennai and his associates, and this was a pan-India study. The aim of this study was to identify the population of diabetes, prediabetes, metabolic conditions, abnormalities, obesity in our own population. This was started in 2008 and it ended in 2020 and was published in June this year in the Lancet journal. There were great the study was conducted in a very systematic manner and it was monitored by the ICMR, which is the Government of India undertaking. What it did tell us that we have about close to 11% of our population, that in absolute numbers is about 101 million population, which has diabetes today above the age of 18 years. And if I go a step further, we have close to 136 million people with pre-diabetes, that's close to about 13% of our population. Now, it's important to know these statistics because pre-diabetes are the people who are intermediate between normal and presence of diabetes. And if you don't instill an aggressive intervention in this pre-diabetes group, they are going to be in future developing diabetes. So here's where the prevention program has to be sort of very aggressive if we have to keep them towards normalcy and prevent our future rates of diabetes going up. Globally, a lot of it is being done to see how we can target the population with pre-diabetes. And so also from our national body, we are undertaking measures. And I'll just give an example of that, where we ran a Defeat Diabetes survey. This was done last year, where we said that how many people have tested the blood glucose. And because ethnically we are a high-risk population, it is mandatory for each one of us to test our blood glucose at least once. And to bring this awareness into our population, we said that let us take it out in the population. Can we target 100 million people in 100 days? And we were happy to say that we targeted 128 million people in 100 days. And we initiated 1 million blood glucose testing in a single day, which brought us into the Asia Book of Record. And when we analyzed the data, we found that almost about 18% of our population did not know that they have diabetes, and they were detected to have diabetes for the first time. The ICMR INDIAB study went on to tell us what is a population at risk or population that has presence of abdominal obesity, because we are termed as thin fat Indians. That means we look thin, but we have a lot of adiposity and a lot of central obesity, which means our livers, our pancreas are laden with fat, which makes them at a higher risk for development of diabetes and many other sort of medical problems. So given this fact that we have close to about 50% of our population which has obesity, here's where we need to target very aggressively, because we know that obesity is the mother of all non-communicable diseases. And the WHO runs a program, the Government of India runs an NCD program, and one of the components, what we term as metabolic syndrome, is driven by obesity. So let us try and work in all these areas, and that's where Sahyadri Hospital has become in the front, where we have set up this Center of Diabetes, Obesity and Metabolic Diseases, given from the background of the ICMR study and as well as what we see trends in the population, where we see a large amount of people with non-communicable diseases. We thought that this center should project a 360 degrees view and see how we can see our patients through in terms of not only blood glucose control, but also control of their weight, improve their nutrition habits, which contributes to the weight. We have a huge number, of largest population of type 1 diabetes in our country, and that's alarming. We have got small children who don't make it to adulthood very often because of various reasons. So we have set up a center with our experts with type 1 care. We're looking at pregnancy diabetes program because now we have enough studies to show that the entire risk for diabetes starts from the womb onwards. The national body RSSDI is one of the largest organizations for doctors who are dealing with diabetes in the world. And we have close to about 12,000 members. We have partnered with numerous international organizations to see how can we collaborate with them in the area of research, education, and patient care. And I would like to say that we have recently partnered with the JDRF, that's the Juvenile Diabetes Research Foundation, which sort of is involved in type 1 care. Also, we are one of the largest sort of organizations of International Diabetes Federation, Southeast Asia, and it's one of the member organizations of the International Diabetes Federations. We have been partnering with many other international organizations for guideline building, for policy making, and seeing how can we work with them in rural population of our people to see that we can bring advanced healthcare systems for improving our healthcare in the rural sectors. So there's a lot that we are doing from our body, and hopefully we will see a change happening as time elapses.